I now recognize Dr. Joyce from Pennsylvania for 5 minutes of questions.
Thank you, Chairman Wenstrup and Ranking Member Ruiz, for holding today's hearing. And thank you to both Dr. Anderson and Dr. Gary for testifying before this committee today. This committee has worked tirelessly, peeling back the layers on the events that transpired amidst the devastating coronavirus pandemic. The members of this committee have been charged with a great responsibility by the American people. Our job is to shine a spotlight on the public health officials and agencies for their mishandlings and to hold them accountable. We are tasked with analyzing their misguided, their ambiguous, and their flawed policies so that we can learn how to better prepare and address any potential public health emergencies in the future. Further, this committee's investigations will finally expose the true origins of this deadly virus that destroyed millions of lives and livelihoods across the globe. In April, just a few short months ago, this committee held a hearing where the former director of the National Intelligence Agency, John Ratcliffe, testified. In that testimony, Director Ratcliffe said, and I quote, "If our intelligence and evidence supporting a lab leak theory was placed side by side with our intelligence and evidence pointing to a naturally occurring spillover theory, the lab leak side of the ledger would be long and overwhelming, while the spillover side would be nearly empty," unquote. Nearly empty. Dr. Anderson, this quote came from the former director of national intelligence and someone who has access to the most sensitive information provided by our intelligence community. If this is the case, can you explain how the proximal origins piece, of which you are an author, totally contradicts that information from our intelligence community?
The proximal origin paper is the result of scientific work by international well-known experts. I think it's important to realize that if we look at the recent report from the Office of the Director of National Intelligence Community, is that one of their conclusions is that there's no indication that the VIV's pre-pandemic research holdings,
but I am
including
referencing, please allow me to address what information we had in front of us. I'm addressing what we heard Radcliffe tell tell us as a committee that that wasn't the case, that overwhelmingly the information at hand provided by the intelligence communities showed that this was not a naturally occurring process. Dr. Anderson, in your testimony, you said the recently declassified report from the Office of the Director of National Intelligence does, as you said, conclude that there is no evidence to suggest this virus came from the lab. However, the ODNI also states in their reports the Department of Energy and the Federal Bureau of Investigation assessed that a laboratory-associated incident was the most likely cause of the first human infection of SARS-CoV-2. Dr. Anderson, you also said in your testimony, we do not believe that any type of laboratory-based scenario is plausible. And yet the conclusions by the Department of Energy and the FBI directly contradict your position. How do you bring that together?
I think you could say that our conclusions completely contradict their conclusions too. I think it's important to understand that we are looking at different things here. You're talking about the intelligence community. If you look at the scientific literature, the scientific evidence for this pointing to a single market in the middle of Wuhan is overwhelming. There is no evidence.
But the Intelligence Committee had access to both scientific and the investigative reports. They had that overview. And their conclusions strongly contradict what your single conclusion projects. And we as a committee have heard this repeatedly, that the overview from both the FBI and the Department of Energy support that there was a lab leak, support that the most likely cause of the first human infection of SARS-CoV-2 was a laboratory incident. We recognize how that occurred. We as a committee have formed what we feel is most important in understanding all the information that's brought forward to us. and that information points directly to a lab leak. My time has expired, Mr. Chairman, and I yield back.
I now recognize Ms. Ding.